Our job is to really identify cancer as quickly as possible and then get those patients to the next level of care as fast as possible. So what we've done is we really have taken that unstructured.
Welcome back to Cancer Buzz. I'm your host, Summer Johnson. That's Bart Daugherty from Lifepoint Health. His team created a program that uses AI to analyze health records and then alerts the team to high-risk abnormalities. For the program, Lifepoint Health was awarded a 2025 ACCC Innovator Award. Daugherty will present the AI program and how the team did it at this year's ACCC National Oncology Conference. Here's more of our conversation.
I got into healthcare through the military, right? Through the Department of Defense. I was a hospital corpsman, and my wife also was a hospital corpsman, and got introduced to smoking cessation programs. And my mother-in-law, actually died of lung cancer. And so I've always kind of had that in the background that we should be able to do better here. Working in the imaging space, I've always been more attuned to, looking at radiology reports, and I've known for my whole career about, incidental findings. And then I've had a lot of people over my lifetime that have had incidental findings that weren't acted upon or weren't, managed or taken care of. And so really building a program about this has been something I've worked on for over a decade.
Often innovations are developed in response to specific challenges or to overcome very specific obstacles. What issue was your cancer program looking to address?
Sure. So, when we first started, we were really challenged on why don't we offer lung cancer screening in every one of our hospitals? We had 88 hospitals in 30 states. And so the challenge was, well, why aren't we doing more of this? And what's preventing our hospitals? So we did an assessment. We looked at what everybody was doing and what their challenges were. And at the time, there was this registry requirement that was extremely burdensome for staff, and it was complicated. What's a PAC year? Things like that. And so we determined at the time that we needed some software to really help our hospitals get through that. And we also wanted to add a component to where we were capturing incidental pulmonary nodules and making sure that those patients also got the necessary follow-up. Just because, screening levels were low, we were having a hard time capturing patients that, getting them to come in and be screened. And so an incidental pulmonary nodule program was warranted. So we did the research, we found a good solution, and then started implementing it in all of our hospitals. That took a couple of years, but we were able to be probably the first large hospital company in the country to offer a lung cancer screening program in every one of our hospitals, and also offer an incidental pulmonary nodule program.
Innovation in times of workforce shortages and budget shortfalls can be daunting. What has funding and buy-in look like for this program?
We continue to this day to kind of prove the merits of the program. When we initially started, we started with a small pilot with a few hospitals. It was successful, grew volume. We really made an impact in our patient populations, saw stage shift, things like that. And we continued to prove that throughout the process. We did waves of hospitals, did an assessment. Let's continue to push forward and get it in all of our hospitals, and continue to report that out to leadership today on how well the program's going. We always talk about our success stories where we've impacted patient lives and we've made a difference in those communities. And then there's also a downstream impact in those hospitals where we're improving our diagnostic volume and also, supporting complementary services and growth in those hospitals too.
What has been the impact of this program on your cancer team?
We've taken a lot of the administrative burden off of them and allowed them to focus on those critical patients. Really, my goal was to give our navigators time to manage their patients appropriately. So, for example, that breast patient that may have breast cancer, the navigators can then potentially have more time to go to that first oncology appointment with that patient and support that patient. And so we've taken all of that administrative burden of letters and those routine patients follow up and things, and really just put that into an automated process that there's systems taking care of that in the back end. And then really just enabling them to practice at the top of their license.
You can learn more about Daugherty's program and Lifepoint Health's use of AI during his presentation at the 42nd National Oncology Conference this fall. All of this year's Innovator Award winners will be presenting their winning programs in detail, with the goal to help other centers replicate the work. That conference is happening October 15th through the 17th in Denver. There's still time to register. You can head to the show notes for a link to that. Also, if you haven't listened to all of the interviews with this year's Innovator Award winners, you can go back into your Cancer Buzz feed to check those out. Thank you for listening. For the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.